You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
All right. So it's great to talk with you all today. My name is Elizabeth, and let me just start my video too. There we go. Hi, everyone. I'm Elizabeth. I am a PGY3 at Loma Linda, currently the wellness chief, and I have our two other chiefs here, our academic chiefs as well, who will be talking a little bit. So our program is Loma Linda University. There we go. And so we are located in Loma Linda, California, in the Inland Empire area. What's great about our program is, if you can see on this map, we're really close to a lot of places. So we're like a 1 hour drive from the mountains, a 1 hour drive from the beach, probably an hour drive from like wineries and different areas. So I think it's a great location, and you're able to take day trips to a lot of different places. So here's a trip that you can take out if you live in Loma Linda. This is Laguna Beach. This is about an hour and a half drive. Super pretty and super pretty to see. And then here we have a picture of Big Bear, so you can go skiing. Also, Mammoth is a great place to go skiing at. It's about 4.5 hours away. Has better mountains to ski or snowboard on, but also just an hour away is Big Bear, so it's very pretty as well. Oh. I think mine skipped ahead. It's lagging a little bit. Okay. And then last we have is San Diego. This one's a little bit further, usually about 2 hours drive away, but also just a great place to visit. And it's by the beach as well. And so it has really good weather, super pretty. And then here we are, and this is Temecula, where you can go to a lot of wineries and just hang out. So Temecula, I believe, is about an hour away. So everything's pretty much driving distance and something you can do and make a day trip out of. Sorry, I think everything's kind of lagging, so just bear with me. Okay, here we go. So Loma Linda was actually one of the blue zones. So National Geographic basically did a study, and they found that there were certain areas in the world where people lived the longest. And so those were called one of the blue zones. And Loma Linda was actually found to be one of the blue zones. Other places that were listed as a blue zone included Okinawa, Sardinia, Icaria, Greece, and Nicoya Peninsula in Costa Rica. So there was just a few places where they found that there was some kind of secret to long life. And so Loma Linda, we kind of pride ourselves in that. And we have a lot of different values. And I think this is why is like one of our secrets to long life. So just different ways we like to spend our time is, finding a sanctuary in time. And then one of the main things at Loma Linda is we like to maintain a healthy body mass index by getting regular moderate exercise, and then spending time with like-minded friends, and then a lot of things like snacking on nuts, giving something back to other people, doing a lot of volunteering. And then they also value eating meat in moderation. Not everyone is vegetarian, but you'll probably see that if you come to Loma Linda, that quite a bit of people in Loma Linda just happen to be vegetarian. And also eating early, having a light dinner. Those are some of the things that they found that most people in Loma Linda would do. And so maybe those were some of the contributing factors to long and healthy living. And then also a plant-based diet, like I mentioned, which is, you'll see most people are vegetarian, and then drinking plenty of water. And then also we have a wellness program here. So like I mentioned, I am the wellness chief. We have a wellness chief who's a PGY3 every year. And we have a pretty robust budget of $3,000 per year. And we like to spend that on doing different activities every quarter. And then also having our own wellness didactics and just having fun and hanging out. All right, so I'm going to pass it over to our academic chief, Christine.
Hi, everyone. I'm Christine. Like Liz said, I'm one of the chief residents this year. Nice to meet everyone. So I'm just going to introduce to you a little bit about our Loma Linda program. Sorry, I think our computer is not cooperating. There we go. So Loma Linda, we are a Seventh-day Adventist-based institution. That said, not everyone here is SDA, and there is no requirement for you to be an SDA part of your religious affiliation to be here. In fact, I find that most people aren't, and they're very accepting of other cultures, other religions. We do have a mission statement for our whole university health system, and that is to further the teaching and healing ministry of Jesus Christ to make man whole. You will just see that throughout the hospital, and you will see that a lot of the faculty, staff, residents do apply the concept of trying to be considerate of the whole wellness plan and just finding wholeness in their spiritual health, in their physical, mental health. So if that's something that aligns with your own values, that is something that you would probably find quite robust here. We do have many different facilities. We have our medical center. We actually have a brand new medical center, and I'll show you a picture. It's quite beautiful. It's opening, it says here May, but that got postponed to August. So we're looking forward to moving in August. We have a children's hospital. East Campus, which is where our inpatient unit is housed, also houses an ICU and its own family medicine-based primary care inpatient. We have a BMC, or the behavioral health, which is more psychiatry, surgical hospital, clinics. We even have a satellite hospital in Marietta. So overall, you'll see we just have a good vast number and variety of facilities. Our program itself, this is our value and mission statement, which is probably quite similar, but I also find it quite unique to our program. We like to foster compassionate, growth-minded physicians who are lifelong learners. And again, it's the whole theme of this whole person care. So we're committed to compassionate, patient-centered care, development of framework and skills to address psychosocial and spiritual aspects of patient care. We do have 5 total positions in our program. 4 of those are categorical, which means that you would do your intern year, our PGY 1 year with us at our main med center. And then we have 1 advanced resident who does their prelim or intern year outside at a different facility and then joins the rest of his or her classes of PGY 2. And the advanced resident, so far, you know, they tend to assimilate pretty well into the program. There is just some lag time with system-based learning, but overall, I would say there is not too much interruption to their education between going somewhere else for their intern year and starting with this as a PGY 2. Again, these are just our training sites, just more pictures. This is the old hospital you see here. I'll show you a picture of a new one shortly. This is the East Campus. This is where our inpatient unit is. It's absolutely beautiful. Every patient room is a single bedroom. It has wooden panel walls, kind of looks like a hotel if you ask me. So just absolutely beautiful facilities. We do rotate at the VA, Loma Linda as well. We have an inpatient VA unit, and then we also have our outpatient ambulatory care center where we see all of our outpatient MSK veterans. Then we also go to a Kaiser in Fontana for our more community-based medicine as our PGY4. So it's great to see the variety of different sites that we have. This is just kind of our website, but these are all the offerings we have. Like I mentioned, we have a robotics program here that focuses heavily on the exoskeleton. We also have our O&P department. So we have an in-house orthotics and prosthetics department that we're able to talk to directly and work with, which is quite helpful for our patients. And then we also have a pediatric rehab, more outpatient based, but we do have an inpatient pediatric unit that is community based that we do rotate at as well. So just kind of a brief overview of your rotations. As an intern, again, you're primarily with the medicine, so internal medicine team. You spend about 4 months on an inpatient internal medicine team, and then about 1 month at the ICU, usually at the VA. You'll have some subspecialty clinics and inpatient, such as ID, nephrology, rheumatology. You spend a month with neurology, and very minimal night float, totals out to be less than a month of night float or night calls. And then you come back actually to do a month with PM&R, which is great, kind of a break from intern year or assimilation if you're doing it towards the end. And then you also get a choice of elective. Moving on, when you join us as a PGY2, it's a little heavier on the inpatient side as a 2, but that evens out throughout the years. So you do a stroke rotation, a TBI rotation, and then you do more outpatient orthopedics, amputee based at the VA. You also do outpatient at the VA. You have some Loma Linda clinics. When we say Loma Linda, it's because our East Campus is separate campus from our Loma Linda, but you work with the Loma Linda neurologists and movement disorder clinics, just a variety of different clinics that match your interest. And of course, pediatrics as well. And then you have an option to do an elective as well. When you move on forward to PGY3, you do a spinal cord injury based, inpatient based rotation. And then it's kind of more heavy on the outpatient because we do spend 5 months in our EMG lab. This is immersive, usually mostly straight 5 months. You really get immersed into this EMG world, which I found to be very helpful than rather than just breaking it up here and there. So I think that's something unique to our program as well that I really appreciate. And then you have elective time as well.
5 minutes.
Okay, as a 4, you get more outpatient-based rotation. On to our other chief for more of the didactics.
Hi, everyone. I'm Roya. So I'll be really quick about the didactics, so we leave some time for questions. So we do didactics, basically stroke, TBI, neuromuscular, orthotics and prosthetics, spinal cord injury, peds, pain, rheumatology. We do joint lectures with rheumatology and PM&R, and these lectures are basically modeled after Kukurilla, which is the main board review text. And then we also have ground rounds, which includes the other departments and the therapist. Evidence-based medicine and journal club, we do about 4 to 6 lectures every year, and it can change with each year just depending on resident feedback. And then the PGY3 residents do lectures on morbidity and mortality every year. And then each residency class actually does a quality improvement project each year. So as a PGY4, for example, we'll do a project with the other PGY4 residents. And then we also have lectures on whole person care. On Fridays, so those lectures are all on Wednesday afternoons from 12 to 2, and then on Friday afternoons from 12 to 1. We have anatomy, physical exam workshops, radiology lectures, clinical cases where we go over board review to prepare us for oral exams, therapeutics and musculoskeletal ultrasound. For the ultrasound, we also do procedures. So we make 3D joints, and then we embed them in like a gelatin mold, and then we actually do ultrasound to make sure that we can get into the joint. And then we also have resident wellness lectures. Most recently, Liz actually did kind of a Amazing Race scavenger hunt as our first resident wellness lecture of the year, just to kind of get everyone, all the PGY2s who came in, meet everyone, and kind of a fun experience for us. And then we do neuromuscular in EMG lectures, as well as having anatomy lab, cadaver lab, where we're also teaching the medical students. Okay. And then all residents participate in a scholarly activity. We do get research guidance and support from the department's research advisor. We have quarterly research labs where we meet with Dr. Tran, who's our advisor, the main kind of research advisor. And then at the end of our PGY 4-year, we actually present our research. I think it's lagging still. I'll skip over call benefits. Just I'll say that our call is pretty good, but when you guys interview, we can go more in depth about that, or if you have questions afterwards, I can discuss. And then the Drayson Center, so we do have access to a gym. It's just a few minutes away. You can see a lot of different things there. And then for people who are interested in fellowships, so we do have a pain fellowship here at Loma Linda. This last year we had 2 of our residents go in. And then cancer rehab, we had 1 resident go into cancer rehab recently. For patients or for people who are interested in sports medicine, we do rotate at the Kaiser Fontana, which is about 25 minutes away, and there's a sports fellowship position there. And so you do get exposure in that. And we have had a couple residents in the prior years, 2018 and 2019, who went on to Georgetown to do their sports medicine fellowship. So a lot of different places that our residents have gone. And then this is our contact info. Please feel free to reach out to us. We're happy to answer any questions. And then if anyone's interested, our EMR is Epic. And then we also rotate at the VA, so you have a CPRS there.
All right, thank you guys. If you have just like a couple minutes for questions, if anyone has them, you can drop in the chat.
Over here.
Oh, yeah. What is the atmosphere among residents like? It's great. Actually, we all really get along. We have like a group chat that we're constantly talking to each other in it. I think like when sports come up,
Game nights.
we have game nights. Like we're doing a game night at the end of July.
We go to the beach.
Yeah, we go to the beach. We hang out a lot. Do you all use OMT on patients? Do you have OMT clinics or didactics? Great question. So Christine and I are actually DOs. So we have 1 DO faculty member who's at the VA. So according to ACGME, you need to have a DO faculty member in order to do OMT. So the DO faculty member at the VA does allow us to do it. We're trying to incorporate more OMT into didactics. Right now we do it like every other Thursdays. It's just optional. And then we're working on creating an OMT elective. OMT is osteopathic manipulative medicine. About how many of your graduating residents go on to pursue a fellowship?
Sorry, Roya, so for the sake of time, move on to the next speaker, but feel free for, if you guys want to hang in the chat and answer all the other questions. I think a few more popped in. But yeah, thank you so much for your time.
Thank you.